Good day, I am Acido, a Level 1 nursing student from Section N15, and I am here to demonstrate the proper procedure of assessing the appearance and mental status, skin, hair, and nails. So, assessing the appearance and mental status is an evaluation of the client's look and mental state in relation to his or her culture, socioeconomic status, and current circumstances. As for the assessing the skin, hair, and nails, it is an overall inspection of the condition of the integumentary system that provides clues to the client's general health condition. The disease and disorder of the integumentary system may be local or caused by underlying systemic condition. Now, as for the objectives of the procedure in assessing the appearance and mental status, the main objectives are to determine client's current mental status, to determine the reliability of the client's responses throughout the rest of the examination, and lastly is to acquire information regarding client's level of cognition and emotional stability. So as for the assessing the skin, hair, and nails, the main objectives are to obtain information about the nutritional and hydration status and overall health of the patient, and lastly is to obtain information associated with certain systemic diseases, infection, immobility, excessive sun exposure, and allergic reactions. So as for the preparation for the procedure, we are first going to greet and identify the client and explain the procedure on how she can cooperate. Good day, ma'am. I am Acido, and I will be your nursing student for today. So today, ma'am, I will be assessing your appearance and mental status, and as well as your skin, hair, and nails. So before that, ma'am, may I ask for your name?
My name is Nicole Arapan.
Alright, thank you so much, ma'am. So after that we have greeted and identified the client, and we also have explained the procedure, we will then be performing proper hand hygiene and observe appropriate infection control procedures. So I will be getting my alcohol to sanitize. I will also let my patient do the same. Now, after preparing hand hygiene, we will then prepare all the materials before proceeding in assessing the client and provide client privacy. So, assuming that there is a window here, we are going to close the curtains to provide client privacy. So, proceeding in the procedure of assessing the appearance and mental status of the patient, the first thing we must do is to observe body build, height, and weight in relation to the client's age, lifestyle, and health. So after that, we are going to observe the client's posture and gait, standing, sitting, and walking. So observing the client's body build and height. Ma'am, can you please stand? Now observing the gait. Now can you please sit back down? Now, this time, can you please walk from that point to this point? Then go back. Then sit down again. So after that is we are going to observe the client's overall hygiene and grooming by observing or identifying any foul odors in the patient. So we must relate these to the person's activities prior to the assessment. Now after that is we are going to note body and breath odor in relation to activity level. And after is we are going to observe for signs of distress in posture or facial expression. So upon interviewing the patient, we must make sure that the patient has eye contact to the examiner. And also, the facial expression should be appropriate for the question that is given. Now, after that is we are going to note obvious signs of health or illnesses. Then, assess the client's attitude. And then, note the client's affect or mood and assess the appropriateness of the client's responses. Then, we are also going to listen for quantity and quality and organization of speech. also as well as the relevance and organization of the patient's thoughts. So these should be all in accordance or in appropriateness with the questions that are being given during the procedure. Now after that is we are going to document findings in the client record. Now after that is we are going to document findings in the client record. Now after that we have already assessed the appearance and mental status of the patient, we are then going to assess for the skin. So the materials and equipment needed for this procedure is the millimeter ruler, examination gloves or clean gloves, and then magnifying glass. So in preparation, we must assemble all the materials and equipment needed. And before we proceed to the procedure, we are going to wear our clean gloves. So wearing our clean gloves can help to prevent cross-contamination, since we will be holding or touching the skin of the patient in the procedure. Now after wearing our gloves in the procedure, the first thing we must do is to inquire if patient has any history of pain or itching, presence and spread of any lesions, bruises, abrasions, or pigmented spots, then skin problems, associated clinical signs, problems in other family members, related systemic conditions, use of medications, lotions, or home remedies, excessively dry or moist feel to the skin, tendency to bruise easily, and any association of the problem to a season of the year. Now after inquiring the patient's history, we are then going to inspect the skin color of the patient. We must inspect for the uniformity of the skin color. So starting off with the nearest arm or hand to us. I'm going to examine for the skin color. Now after assessing for the uniformity of skin color of the patient, we are then going to assess the edema. So in assessing the edema, we are going to pinch the skin of the patient. And in pinching, we must make sure that the skin should recoil. Now after assessing the edema, we are then going to inspect, palpate, and describe skin lesions. So in palpating the skin lesions or in palpating skin lesion of the patient, we are going to use the index finger and middle finger, and we are going to palpate up to the upper extremity. Now also to the other side. Now, if there are any abnormalities that we have found on the patient's skin, such as skin lesions, we should use our magnifying glass to determine the type of lesion. So since I don't have any magnifying glass, I'll be using these glasses as its alternative. So using magnifying glass helps us to visualize it even clearer or even properly. Now also to the inner portion. Also to the other side. Now after that, if there are any change of the skin that we have noticed, then we must measure it using our millimeter ruler. So using this millimeter ruler, we're going to measure the skin lesion. After that is we're going to note the circumference and diameter of the skin lesion. So we must note for any prickles, macules, or papules, or any changes of the skin. Then we have to describe lesions according to location, distribution, color, configuration, size, shape, type, or structure. Now after that is we are going to observe and palpate skin moisture. Now after that is we are going to palpate skin temperature, and in palpating skin temperature, we are going to touch the client and we are going to compare this side to the other side. Thank you. So after that is we are going to note skin turgor by lifting and pinching the skin on an extremity. So this is the last assessment where we can determine the hydration of the client's skin by merely pinching the skin of the patient. So we must take note that when we pinch the skin of the patient, it goes back to normal. Now after that is we have to make sure that there are no any signs or any forms of dehydration to the client's integrity. Then we are going to document findings in the client record. So note for any abnormalities and changes of the skin of the patient. Then we must also draw the location of skin lesions on body surface diagrams. Now after assessing the client's skin, we are then going to proceed in assessing the hair of the patient. So we must take note that in assessing the patient's hair, we will still be using or wearing our clean gloves. Now in the procedure, we are going to inquire for the condition of the client by determining any health history of the patient, such as recent use of hair dyes, rinses, or curling or straightening preparations, recent chemotherapy, and then presence of disease or any diagnosis condition that causes hair loss. Now after that is we are going to inspect the evenness of growth over the scalp. So we have to move to the back of the patient. Now we will be inspecting the evenness of growth of the patient's hair. We must make sure that our hand is formed in a letter C, and then we're going to start from this side and also to this side. Now after that is we are going to inspect hair thickness or thinness, or also we are going to inspect the hair texture and oiliness of the patient's hair. So in inspecting for the texture of the patient's hair, we're going to get a strand of the patient's hair, and then we're going to apply pressure using our thumb, and we must make sure that the hair won't break as we apply pressure or it won't brittle. Now also on this side, we're going to get strand of hair and then apply pressure again. After that is we're going to inspect for the oiliness of the hair of the patient and as well as the dandruff that is present on the scalp. So we must take note that minimal dandruff is normal in a normal individual. Now after that is we are going to note presence of infection or infestation by parting the hair in several areas and checking behind the ears and along the hairline at the neck. So we're just going to separate into several areas. And as well as the hair in the neckline. So we must ask the patient to slightly bend her head. So ma'am, can you please slightly bend? Now we must take note the condition of the hairline and the neck. Now after that is we are going to go in front of the client, and then we are going to inspect the amount of body hair. On this side. Now after that is we are going to document findings in the client record. We must note all the abnormalities that we have found in the patient while we are assessing the patient's care. Now after that we have already assessed the skin of the patient, we are then going to proceed to the last assessment, which is assessing the nails. So in the procedure, the first thing we must do is to inquire if the patient has any history of diabetes mellitus, peripheral circulatory disease, previous injury, or severe illnesses. Now after that, we are going to inspect fingernail plate shape to determine its curvature angle. So we must note that the normal curvature angle is 160 degrees. Now after that, we are going to inspect fingernail and toenail texture and as well as the bed color. So we must make sure that the cuticle is intact. And also the toenails. Now after that, we are going to inspect tissue surrounding the nails. So we must make sure that there are no any deformities that is surrounding the patient's nails. Now after that, we are going to perform blanch test of capillary refill. So we are going to press 2 or more nails between our thumb and index fingers and look for blanching and return to pink color to nail bed. So normally when we do blanch test, normally it only takes less than 2 seconds until it recoils. Now also to the other side. Now after that is we would also want to ask the patient after a blanching test if there are any pain that he felt during the procedure. So ma'am, have you felt any pain during the blanching test? Right, thank you. So after that, we are going to document findings in the client record. So that would be all for the procedures of assessing the appearance, mental status, skin, hair, and nails of the patient. Thank you.